Okay, we will go ahead and get started, and we'll just wait for people to go ahead and trickle in. But again, drop your name in the chat, let us know where you're from and why you joined the conversation today. And thank you all so much for being a part of this webinar session. So my name is Morgan Bradley, and I am the Community Outreach Program Manager and Regional Coordinator with Texas A&M AgriLife Extension Service in partnership with the Texas Council for Developmental Disabilities, or TCDD. And I am joined today with my colleagues from across the state who are helping with technical assistance. And before we get started today, I'll quickly go through an overview of today's discussion and provide a few quick Zoom tips. So as far as Zoom, all of the attendees are muted and your cameras are off. So if you need to interact with the presenters today or with any of the colleagues who are present to be able to get technical assistance, please utilize the chat box to be able to talk to us, to drop questions and everything else. We will have time at the end of the presentation for Q&A, so hold questions. Well, feel free to drop questions in the chat, but hold questions till the end and we'll be able to provide those questions to the speakers. All right, and then closed captioning is also provided through Zoom. And if you click on your bottom right-hand side of your screen, you can enable the closed captioning to be able to follow along with the transcription. Okay, so the Texas Council for Developmental Disabilities, or TCDD, is a statewide governor-appointed board that is the only entity in state government solely focused on the needs and interests of individuals with developmental disabilities and their families. TCDD is mandated to provide input on state policy initiatives, build communities through statewide grant projects, and educate and inform the public and leaders on developmental disability issues. And for more information, a link has been dropped in the chat. Texas A&M AgriLife Extension Service is the outreach and community education arm of the Texas A&M system. For its more than 100-year history, Texas A&M AgriLife Extension has worked to help Texans better their lives with practical, applicable learning through a statewide network of professional educators, trained volunteers, and a presence in all 254 counties and the campuses of Texas A&M University and Prairie View A&M University. And a link has been dropped in the chat to learn more about Extension. And TCDD partnered with Extension because TCDD has continued its partnership because Extension has a commitment to help Texans better their lives through all that I have previously mentioned. And there are regional coordinators located all throughout the state to aid in this collaborative effort and to be the boots on the ground to connect a lot of what TCD doing at the state level to those local and regional agencies, organizations, partnerships, individuals, and their families as well. And more information about the regional coordinators and how to stay in contact with us has been dropped in the chat as well. And if you want to know more information about those agencies, you can find out more by visiting those links or reaching out to us, and we'll provide more information at the end of this presentation. And I will now turn it over to my colleague, Andy Crocker, who will introduce our speakers for the presentation today.
Thanks, Morgan. I'm going to introduce today's speakers, Dr. Arnold and Dr. Hiller of the Department of Disability and Human Development at the University of Illinois at Chicago and its University Center of Excellence in Developmental Disabilities. Dr. Hiller is a distinguished professor, department head of the Department of Disability and Human Development at UIC, and director of the Rehabilitation Research and Training Center on Developmental Disabilities and Health and the Family Support Research and Training Center. Her research focuses on health and long-term services and supports for individuals with disabilities and their families. She serves on the Executive Council, directs its publication committee, and is vice president of the Americas for the International Association for the Scientific Study of Intellectual and Developmental Disabilities, was the president of the Association of the University Centers on Disabilities Board, a delegate to the 2005 White House Conference on Aging, and co-founder of the National Sibling Leadership Network. The newly minted Dr. Arnold is the Associate Project Director at the Institute on Disability and Human Development at UIC, Illinois University Center of Excellence in Developmental Disabilities. She's passionate about supporting people with disabilities and their families to live full lives. She's also helped to grow the sibling movement across the country in her role as executive director of the Sibling Leadership Network, a national nonprofit with state chapters that provides information and support to siblings of people with disabilities throughout their lifespan. Her sibling experience has shaped her worldview and influenced her career path. We want to give a warm welcome to Drs. Arnold and Hiller for joining us today, and we'll now turn the session over to them.
Hold on. Slideshow.
Great, thank you so much. I think Tamar is gonna share her screen with the slides now.
Okay. Share.
And we'll get started.
Did it share?
Yes, it's shared. Do you want to just do from beginning and then?
Yeah, slideshow from beginning. All right. Oh, so you got it. Let me move these pictures out of the way. Okay. So welcome everyone. And as you probably heard in the description, both Katie and I have a lot of passion about this topic, both professionally and in terms of our personal interests. We're both siblings and we both have sisters that have intellectual and developmental disabilities. And so today we're going to do the first part of the series, which is about taking the big step. So what I would like to do is to give some context, talk about some overview of research on families and some of the implications of that for future planning and thinking about that. And then we will tell you about some of the research and some of the work that we've been doing in this area. And then we will have Katie really go through the steps and how she's worked it out with her family. So look forward to hearing more from all of you and any questions you may have at the end. So we know that there's a lifelong impact of caring for a person with intellectual and developmental disabilities because families often provide lifelong care. And there's different ways of thinking about it. Some people talk about sort of a wear and tear, how over time families get more exhausted and it becomes more difficult. But then others have written about adaptation over time, how in some ways it becomes easier over time. So I will give you some examples as we move through some of this. So we know that people with intellectual and developmental disabilities are more likely to live with their parents for much of their lives. And just for example, we know that in Texas, there's 47,695 people who are getting long-term service supports. However, there's also very long waiting lists, which is probably not news to most of you. And from the data I found, there was an increase from 40,479 in 2004 to 217,786 in 2017. And just to give you an idea, and we know that a lot of people don't even bother getting on waiting lists. So there is an issue with that. And we also know that families and persons with disabilities need to engage in future planning. There's lots of evidence of why it's so important. So you don't have emergency placements and you don't have the stress when parents can no longer take care. Extremely important. And we will talk about some of that and why many families don't plan. Just to show you some general statistics in general, we see that about 71% of people with IDD are living with family caregivers. And we also know that many of them are over age 60. This is from national sample and it's probably not much different in Texas. So what does a lifelong impact for families mean? So some of the research has shown families experience chronic stress and poor mental health and quality of life outcomes that are poorer than for other people. However, there's a greater risk for the underserved groups. And that's where you see many of these challenges. We also know that as people age and the parents age, it becomes more difficult. So many times families have accommodated, and it becomes easier for families, but then when the parents become more frail or pass away, then there's issues that come up. On the other hand, caring also has its positive aspects. And so we'll talk about some of the positive aspects that families experience and also the resilience of many families. So in terms of economic, there have been studies showing the economic impact, for example, in reducing work hours, in changing jobs and stopping work, taking leaves of absence, especially for mothers. Caregivers of individuals with IDD are less likely than non-caregivers to be employed. They miss more days of work. They have less savings, less for retirement. And especially these findings occur for racial, ethnic, minority groups. So these are things to keep in mind as we think about future planning. There's also health and social impacts. So many parents of adults with disabilities have higher stress, depression, anxiety, and physical health issues. But again, it's not across the board. And you see more of that when there's more needs for behavioral supports, complex healthcare needs, difficulty getting services. And I want to emphasize this last piece of difficulty getting services is so important. Many people are compound caregivers. They're not only caring for a son or daughter with intellectual developmental disabilities, they may be caring for parents, grandparents, other children, siblings. So this is what we mean by compound caregivers. And there's often a greater impact in those situations. And racial ethnic minorities, there's been quite a bit about that and the impact. And much of that is related to the difficulty getting services. We know that social networks are more restricted, as especially for mothers that focus on caring, this lifelong caring for a son or daughter with disabilities. We also know the impact changes over time. So we really like to think of it in a life course way because things continually change. And as we do future planning, we also know that that whole process changes and whatever plans get made get changed over time. So what about the impact on caregiving appraisal? We know that future planning and community involvement are both related to more caregiving satisfaction and caregiving self-efficacy and feeling like they're able to do better caregiving. And we'll talk some more about that later. And again, when there's challenging behaviors and the poor health of the adult with autism or other intellectual and developmental disabilities, that's related to caregiving burden. What about the positive aspects? And we know that there's many positive aspects. In early research that I did, I found that among aging caregivers, 90% said that caring for adult son or daughter with disabilities was a source of fulfillment and meaningfulness, 90%. So it was a really big amount. And some report better mental health and life satisfaction. There's also the concept of reciprocity in caregiving, especially to aging parents, where the person with disability is helping their parent. And in many ways, there was a really cool program in Connecticut where the people with disabilities were learning how to be caregivers for their parents. And I know that Katie Arnold just did a big study that actually looked at that whole issue and found that to be a major theme in looking at people with disabilities with the IDD who were living at home. And then there's the issue of resilience among caregivers and, which caregivers show a lot of resilience, and it's usually those that have lots of social support and higher quality of life and feel like they can manage, and they use problem and meaning focused coping styles. So in terms of family ties and siblings play a long lasting role. This is a picture of my mother and my sister. So here you see, and you can see it's also fueled my passions. And I do visit my sister every other week. She lives about an hour away, but she calls me about 3 times a day. So definitely we're very connected. We talked about compound caregivers. We can think of siblings as the club sandwich generation. Sometimes I think it's more like a double club sandwich for all the different intergenerational kinds of caregiving that people get involved with. So what is the impact on siblings? We know that sisters are often more involved in care of adult siblings. That's no big surprise in general. And as we get older, we get more and more involved in care. So at one point, my parents said, you know what, it's your turn now. They live in Florida and my sister lives in the Chicago area. And they said, now it's your turn. Not that they're not involved, but they're in their 90s and can't really do as much. And then of course, there's some of the negative factors for siblings is if there's a family history of depression, especially the mothers, and if there's been stressful events. A very positive impact is if there's family support. And that is throughout a lot of the research. And we find that sibling well-being and close relationship is bidirectional. So in many cases, the sibling with disabilities and the other siblings have very close reciprocal kinds of relationships. Again, there's more, often a less positive relationship when there's more challenging behaviors. There's been some research comparing Down syndrome and autism and finding that there's less contact with siblings, less positive relationship, and worse relationship with their parents and worse health when there's someone with autism versus Down syndrome. In regard to sibling supports, here you see a picture of Katie with her sister. You'll be hearing more about that. The Sibling Leadership Network that Katie's the executive director, and it's all about advocating for and with our siblings. And there's lots of resources on future planning that this group has done. There's SibNet, which is a way of connecting with other siblings. There's a future planning project called Siblings Forward that's out of Massachusetts that's specifically about siblings and future planning. So thinking about aging and IDD and life transitions, these are some of the things that happen to everybody, but also happens to people aging with IDD. And we see development of chronic health conditions. So this is both the families and the people with disabilities. The changes in family caregiving and supports that happen as people get older and certain people die or become more frail or enter the family, retiring from employment, which may or may not impact the person with disability because many of them are not employed, but they may be in some kind of a day program, and then receiving end-of-life care. And so these are some things to think about and enter into when we start thinking about future planning. We know that the trajectory for people with IDD might be different. In some ways, there may be some earlier aging that happens for certain groups, like for Down syndrome. And I know that you had some webinars on aging in general prior to this that Texas A&M and the DD Council put on. So we're not going into big detail on that. So worrying about future care, here's some extreme examples that got quite a bit of publicity, but I think, I don't always like to talk about it, but I think it's important, and it's happened all over the world where you hear these kinds of tragedies when people do not plan. These are extreme. However, the comment, I wish my child dies 4 minutes before I do, is not unusual. I've heard it in focus groups. I heard my own father say that when things were going really bad for my sister, when she was getting very bad services and was having a lot of issues. He would not say that now. And there was a story in the New York Times, and actually I was quoted in this story about an 82-year-old man who killed his son, his daughter, his wife, and himself. And he was worried about what would happen when he was no longer alive and what would happen to his son with intellectual disabilities. And I have to say that I did focus groups in that same community many years before, and that's where the first time I heard, I wish my child dies 4 minutes before I do. And then there was a story also in the Chicago area, unfortunately both in Illinois, these stories, about a woman who adopted a baby with cerebral palsy, cared for her passionately throughout her life. And then when she herself, the mother, I think she had cancer or some kind of disease where she felt like she's not going to live much longer, she killed her daughter. And the shocking part, besides the fact that she killed her daughter, is that the courts wanted to let her free because they didn't see that a person with intellectual disabilities, that their quality of life was the same as other people. And so there was a lot of controversy about this, but eventually she was jailed and she died in jail. So what are some of the issues if we think about adulthood and aging? We know that many adults with autism and developmental disabilities continue to live at home and are unemployed or underemployed with no pension. So when you're thinking about future planning, you got to think about the financial aspects. There's high rates of medical and psychiatric conditions. So that's an issue. And in some cases, it's less with time, but then there's other conditions like dementia that may occur. There's always difficulty finding doctors with needed expertise for adults, especially as they go from pediatric to adult care. There may be some reduction in behavioral symptoms, and quite a few research has shown that. There's some earlier age-related conditions, as I mentioned, and due to the medications, healthcare, health behaviors. You need to address end-of-life issues, which we'll talk about in the third session. And then there's challenges for aging parents who don't have many supports. And as we mentioned, siblings take on a bigger role. Some of the unmet needs of families, certainly as they move into adulthood, many of the needs that are taken care of during school age are not taken care of. In a study that I've been involved with, some of the things that families said that they had unmet needs for were support groups, meal service, respite, assistive technology, home health care, home modifications, and 63% said training or education for future planning, which I guess is the reason many of you are here today. So we know that there's a need to plan for future needs, but why is it that so many families don't plan? Well, many families are unaware of legal and financial options. So that's a really big one. And we know that if they don't plan properly, for example, if they will owe their money to their son or daughter with disability, they may lose benefits. So they need to know more about this. All of us, many of us have fears for the future and the unknown and the anxiety that comes with thinking about what's going to happen when I can no longer take care. And sometimes they're not sure who could be a future caregiver. And even siblings, many parents will say, it's one thing for me to take care, but I don't want to have my child have to do that, the other siblings. And then just getting the process started is hard. Many people, older families, have had very little contact with the service system. And I know there's been studies where, especially with some of the minority groups that come in, have not been very hooked up with services at all. And the person is basically living at home. I know there was a study done in I think it was Georgia, where most of the families that were living in these remote rural areas were not even connected with any service system. Sometimes they're found through the aging network. And then there's a lack of collaboration between the aging and disability service systems. And I could talk a whole hour about that, but for another time. And then there's other age-related needs and daily demands that people have. We do know that planning is related to the resources people have, the way people cope, and what options are in the community. I had someone working for me when we were early on doing some of this kind of work, and she had a son with Down syndrome, and she very angrily said to me, I don't know how to do this because there's so few good options out there. And so, of course, part of it is really thinking about how to make some options. It isn't just look at what's out there, but what can you create? So we developed a curriculum called The Future Is Now. We developed it a while ago, but recently we've revised it with Katie taking the lead on that and revising this curriculum. And we'll tell you a little bit about that and what we're doing with this curriculum. The overall goal is for families to make future plans. And it's to develop goals related to it, develop a letter of intent, which is like a roadmap to the will and other kinds of planning, and how to increase advocacy for support. So there are various options that people can think about. We have both a facilitator guide and a workbook from families and people with disabilities. So as part of this, I'm actually going to, first let me tell about the unique features, and I'm going to go back to the previous slide. So what's unique about this particular curriculum is that it integrates both peer-centered and family-centered philosophies. You know, we've talked a lot about person-centered. You know, we all know we're supposed to do person-centered, but it needs to be family-centered too, because the person is in the context of their families and really needs to work out those dynamics, right? Peer support is a very big part of what we do. So we have peer trainers, and which include families who have done plans, who are working with the families as co-trainers with our professional staff. And then also we have people with IDD who are peer trainers, and we do training with them. We do a lot of problem solving around family dynamics and family values, because different people in the families are going to have different ideas of what they want. And the focus includes both the current and potential community supports. And because we do this nationally, as we work in different states, we have guest presenters with content specific to their locale, because you know, you're going to have guest speakers who are going to talk about the kinds of options and housing and those kinds of issues that are within each state. This is the overview of the curriculum. The first one is taking the big step, which is much of what we'll talk about today. But other aspects are building relationships and self-determination, supporting community living, very important, and then choosing education, work, and retirement options. You know, some people want to continue working if they're working, and maybe haven't even thought about retirement options. And then keeping the dream as we age. So we spend a lot of time on the dreams, the nightmares, the successor. You know, who's going to be doing that when the parents aren't there. A letter of intent includes essential information about the individual with a disability strength, preference, interest, support needs, and health. And again, this is done together with the person with disabilities. It's not just something the parents sit and do. And it identifies goals about, for example, to expand friendships and supports. Unfortunately, many adults with IDD say the parents are their only support network. I've seen that a lot. About making future living arrangements, very important, whether it's living with another family member or trying to get into some other kind of home setting. Arranging for post-secondary education, work, retirement, and of course, designating a successor caregiver, very big piece. So we have tested the Future is Now with kind of evidence-based, we call it, because we did randomized design and had funding from various federal agencies to do the research on it. And we did 1-year follow-ups, sort of pre and post. And what we found is that there was an increase in future planning activities, including writing letters of intent, preparing a special needs trust, initiating planning for future living arrangements. The other aspect is that for families, there was a reduction in their feelings of burden and an increase in the daily choice making of individuals with IDD. So those are some very important outcomes that we had. We had done these in person at the time. What we're doing now, we have a project where we're transitioning it from in-person to virtual. And we've done train the trainers in 8 states with the ARC in terms of, and then now we're doing the virtual Future is Now using Zoom for real-time interactive sessions. And we're developing that now. And with the boom with Zoom and with, since COVID, we know that we can do this. And we've been testing this and we will be rolling it out to different states pretty much in the fall. So we're looking forward to that. I did put on here the site of the ARC has a wonderful future planning site. And we're working with the ARC on our project. So you may want to look at that site, including our sites as well. And I am going to be turning it over to Katie soon. I think maybe I'm just going to have her take over right now. So Katie, I guess I should stop sharing, right? And you can start with this slide.
Why don't you keep sharing and I'll just tell you when to advance my slides.
Okay, that's fine.
Yeah.
So you go ahead and take over.
Yeah, sure. So, when thinking about taking the big step, I mean, there's a lot of parts to it. Just the awareness of the need to plan. I think a lot of families have that awareness, but there's those barriers that need to be overcome that Tamar talked about, the fear, things like that. Even just getting the family together can be challenging, but it can also be really rewarding, to really make sure that everybody gets on the same page over time by having these difficult conversations and figuring out all the elements that are needed for the life of the person with the disability that impact the entire family and what roles the different family members want to play. We like to talk about how everyone should have a voice and a choice in the process. And the only way to do that is to really get the whole family together. In many families, it's really the parents that are thinking about it and talking about it and not always sharing that information with the others in the family, the other siblings in the family. And Tamar, mentioned it's because, parents often don't want to quote burden their other kids. But I'll tell you as a sibling myself, we are wondering and worrying about this, whether we're, having conversations about it directly or not. And the whole process, once families start, it really enhances the self-determination of people with IDD. I've seen that in my own family, my sister Patrice, that has really helped her really find her own voice. It's helped my family be aware that, we used to speak for her in many ways, and we were realizing we weren't always giving her the opportunities to speak for herself. So this process has really helped to increase her self-determination and get her involved in making choices for the future that she wants. And then action planning is a big part of the Future is Now curriculum that Tamar talked about, and the whole future planning process. It starts pretty big, just like getting the conversation started. And then it's really down to like let's put some action plans together to figure out like how we can reach certain goals that the person with IDD wants and ways the family can support that person. So these are some of the examples of the big step. On the next slide, I want to share a little bit about my family's journey with future planning. So Tamar, if you want to advance the slide. I can't hear you, Tamar. Oh, there you go. And I want to talk a little bit about how my family took the big step. So this is a picture of me and my siblings. I'm the second oldest of 5, and we're all about 2 years apart. My sister Patrice with intellectual disabilities is the middle of all 5 of us, and she and I are standing back to back in this picture. I'm in the orange scarf and she's wearing the blue dress. So for my family, we've done our best at working through the process of planning for the future. And through my work, I started meeting other siblings and hearing their stories. And some of the siblings I talked to really had difficult transitions as a result of their families not talking about and planning for the future. I had one sibling friend that talked about all these negative ramifications that happened to her family after her parents died because they had never planned for the future. You know, these ramifications were like financial negative impacts, you know, things with their housing and relationships in their family. And it was just really challenging. And frankly, it scared me. And it made me go to my own family to start the difficult dialogue. So it was really from a place of fear that I convinced my family that we needed to start the conversation. For me, I went to my mom first. I told her I was worried about the future, that I had heard other families had sat down and they all talked about it together so that everyone could get on the same page. And I asked if we could, you know, try to do that. So my mom talked with my dad and we decided that the next time we had a family gathering, we would set aside some time to discuss things. We didn't really know exactly what to talk about or how to do it. You know, and our family also does not all live in the same state. So there are really only a few times a year where we're all together in person. But now with technology, I think there's more of an opportunity for families to connect remotely, especially families that live long distance. Next slide, please.
I don't know why it's not moving. As soon as
You want to just push the arrow key?
not moving.
Okay.
Oh, there it goes. Okay.
So my family's
Sorry.
process has been less than perfect. We started meeting when we were all home visiting my parents for a holiday, and we typically try to meet twice a year now, set aside about an hour or two to talk specifically about the future. This often coincides with a big family meal that we have together, either right before or right after. It's logistically challenging sometimes, especially now that, you know, many of us are having our own children and trying to figure out, you know, how to meet and keep the kids entertained. So usually we put on a movie for the kids while all the adults talk about, you know, things in these future planning meetings that we have. At our first family future planning meeting, we quickly discovered that we all had very different assumptions about what the future would hold. You know, an example is our youngest sister, Maggie, assumed that Patrice would live with our oldest brother, Keith, when our parents were no longer around. Well, that was news to Keith. He was open to it, but, you know, it definitely wasn't a given because he was juggling his own family, you know, his wife, 2 kids, 2 jobs at the time. So just having that space to really, you know, each get to go around and share what our assumptions were and realize like, whoa, we are on very different pages. And then also to hear from my sister Patrice about what she wanted. And that was a learning process for us as well, learning how to help prepare her for the meetings so that she could really have a voice in the process, since it's difficult for her to articulate herself. It's difficult for her to process information. And so we really had to build in time in advance for her to be able to know what was going to happen at the meetings and for her to think about things that she might want to share in advance. And one thing that you know I had the advantage of was I was able to work pulling some of the concepts from the future is now that Tamar mentioned, because I've helped work on it. So things from that letter of intent, which is really like the roadmap that families can use to put down information that is really important. And they have this document called a letter of intent that really does help serve as a roadmap for families. So getting the conversation started is one of the hardest parts of future planning. The ARC's Center for Future Planning has developed a tips sheet that includes ways to break the ice and get the conversation started. They created a tip sheet for siblings who are trying to broach the subject with their parents, though the tips are really applicable in any family role. So first, think about what you want to tell your family about the importance of planning for the future. You know, think about what role maybe you foresee playing in the person with IDD's life in the future, other obligations you have in your life that you need to balance, and what information you need to know to support the person with IDD. Another thing that's really important is to be clear about what responsibilities you do not feel comfortable playing in the future. And this can be hard. Even if you wish you could play a larger role, if you know you can't, it's really better to be honest and upfront so that the family knows this and can plan accordingly. There have been a number of siblings who have shared that they have made promises on their parent, to their parents when their parents were on their deathbed, and just the enormous guilt they feel about not really being able to do what their parents wished for because they don't have the capacity and really weren't prepared in advance. So having these conversations sooner is so important. Who should be part of the conversation? That's important for each family to think about, like, who in the family should be part of the conversation, whether it should start all together, like my family had one big gathering, or is it more one-on-one meetings with different people, or a few people at a time? Would it be best for a sibling to talk to their parents first, either together or separately? Should the family, really think about, what the family member with a disability wants in terms of, and when they should be brought into the conversation. For some families, they might want to have some conversations first, among themselves, and then bring in the person with IDD. For other families, they might want to have everyone there together and really center things around the person with IDD. And then think about, like, who else could help you start the conversation or join the discussion at another time, like professionals that do play a role in helping facilitate these conversations for families, or maybe bringing in, somebody to a meeting about, alternatives to guardianship or housing options or things like that. When is a good time to talk? So finding a time to talk when there's not a lot of activities or events occurring, this can be challenging for families. I know for my family, it's really had to be very intentional about setting aside time where we specifically talk about this. Once we've had those more formal meetings, if you will, it's really helped then have the conversations continue in more informal ways. It's helped all of us be able to be open to thinking about new ideas and then talking with each other and sharing things as things come up. So it doesn't all have to happen at those specific future planning meetings, but for my family, that's been really helpful to then, just have the momentum for all of us to feel more open to continue talking about things and evolving in our thinking and our process. Where do you feel comfortable bringing this up? Look for quiet places where your family can have privacy to really talk in a safe environment. If you live out of state, start the conversation by phone or Skype. I know that for my family, at one of our family gatherings, we had an unexpected, family member show up that I wasn't aware would be joining the conversation. And we were sharing some pretty private things about my sister, Patrice. And I felt really uncomfortable that this other person was joining. It didn't feel like the safe space that we had had previously. So really, really thinking about, the space and how families can create that. And for professionals, thinking of ways you can help encourage families to have these conversations, to start the conversations, and then to continue these conversations. And maybe even providing some spaces, that families could go, at a provider agency, or giving other suggestions could be helpful. So breaking the ice, that's often the hardest part. Like, how do you even start these conversations with your family, and, it could be as simple as, having a family member, go and say, I've been thinking about my own life and future, and it's made me realize that, my brother or sister may need things, may need to think about these things too. Can we sit down as a family and talk about that? Be patient and realistic. So this is a hard process for all family members. Your family may not be ready to discuss the subject when it's first brought up. It's a long, slow process, and it's important for every family member to share their views on the future. And I think just having the discussions, a plan will naturally kind of come into place. I know in some families there may be someone who's resistant. I know there's a number of siblings who have said, I've tried to talk about it with my parents and they just won't sit down and talk about it. It's too hard for them. And they're kind of stuck, and it's difficult. And so that's part of the family dynamics that sometimes need to be talked through. And then, also take a break from planning. I mean, once you immerse yourself, you need to step away also and just be a family and enjoy, family time. My family, as I said, pulled concepts from the Future is Now. And at one family planning meeting, we began discussing how we would make decisions about important things in the future. Currently, our parents primarily make all the big decisions related to my sister Patrice, with her input, of course. And I think over time and through this future planning process, they've also become more aware of ways they need to increase her independence to make her own choices. Sometimes they've asked for input, from us, but we've really had to think through what happens when, our parents aren't there. How are we going to make decisions? And instead of waiting until a crisis point where we have to make a big decision, we've really thought through okay, there's 4 of us other siblings, how do we make sure we don't create conflict and division? How will we decide on things and discuss that process before we're in needing to really do it? On the next slide, you'll see that, there's a lot of family dynamics at play. The future planning process gets people talking about things which lead to different opinions and ideas being shared. So conflict is really a natural part of the process. And sometimes people fear conflict because they think it indicates a problem. But I believe that a greater problem can occur if conflict is not discussed and therefore has no chance of being resolved. There can be healthy conflict where people can share their concerns and perspectives. Not everyone will always agree. So identifying who will facilitate the meeting and how to keep track of what you talk about is also important. For my own family, we decided to rotate who facilitates the meetings. For some families, having an outside facilitator can help manage the family dynamics and really ensure that everyone has a voice in the process. Also, think about the best way to track information, both during family meetings and times in between. So for my family, we would often have someone take notes, and then, we'll kind of have a Google Doc where we share some things. On the next slide, in my family, starting the conversation was really difficult, but once we got started, it was easier to keep the momentum going over time. Because of all that we did early on and over many, many years of family meetings, identifying Patrice's strengths and building on them, She's successfully living in her own place with supports. And we've also become more aware of the support needs of each person within our family. And we've used some of our meetings sometimes to talk more broadly about everyone's needs for the future, not just Patrice's. So it's really been an evolving process and not something that will ever be completely done and that we can kind of check off the list. But overall, starting and then continuing the future planning process has given us more peace of mind. We've had a better sense of what the future may hold, what our roles may be in the future. A lot of the anxiety has been lifted because we've had a chance to talk and process as a family. Before I conclude, I want to also mention the importance of taking care of yourself. The analogy for this that comes to mind is, from the airplane safety briefing, where you need to put on your own oxygen mask before you help other people put on their mask. And planning for the future can be overwhelming. Life as we know it is already busy and stressful. For siblings like myself, the club sandwich of juggling multiple caregiving roles makes things even more challenging. And I know as a sibling, I also tend to focus on everyone else's needs and not take care of myself, which was not good for anyone. So I encourage those of you that are kind of in it and family members to, pause and take time to think about your own needs. I know for me, taking care of myself is actually helpful for everyone else in my life because I'm able to show up in a better way. So think about the things that you can do to take care of yourself. Make a list of what helps you feel rejuvenated in your life, what's important for you to take time to do for yourself. Do you have an outlet for people to talk to, or do you want to find a group of family members or others that really get it, that you can confide in? Are you getting the sleep you need? Are you eating right? Do you have outlets for releasing energy, such as working out? And for professionals that may be on this webinar, think about ways you could support family members in these areas. Also, the process of planning for the future can actually be a form of self-care. By planning in advance of a crisis, it will help diminish the extreme feelings of panic at a time of loss or illness. So planning is a way that families can help themselves. Today, we've just scratched the surface of the future planning topic. We have 2 more webinars that will be coming out in our series next week. On July 19th, our webinar will be the nuts and bolts of family future planning. Planning for the future can seem really overwhelming for families, and in this session, we'll break it down into manageable steps and discuss the various areas to think about when planning. This will include legal and financial planning, residential plans, communication supports, and building relationships and social support networks. In this webinar, I'll share a little more about my family's.
You know what? I think there's the wrong dates here.
Oh, you're right. I apologize. It should be July 19th. And then July 27th will be the Engaging with Aging in the Future Planning Process. So I hope you've enjoyed I hope you join our upcoming webinars, and now we'll open it up for questions.
I will stop the share at this point. Just leave it up for a little bit if you want any of the contact information that's on here. And then I'm going to stop share. Okay.
Thank you both so much for a really great presentation. We appreciate y'all. For the remaining time, if you do have questions, feel free to drop them in the chat. The correct dates for the upcoming webinars are July 19th, July 20th, and the 27th. July 20th and the 27th. If you have questions, drop those in the chat, and then we will have some time for Q&A. And then also one of my colleagues will share the link so that you can register for the next upcoming sessions as well. So yeah, July 20th and 27th. So at this time, I'll turn it over to my 2 other colleagues, Genesee and Aaron, to facilitate the Q&A.
All right, go ahead.
Okay. Thank you, Genesee. I will just have the first question, and thank you for those who shared questions in the chat. So we appreciate that. And as Morgan mentioned, please continue to do so. So the first one is from an organization called Imagine Art, who has a focus on helping individuals in the community navigate long-term care planning, especially around housing and healthcare and guardianship, et cetera. And then you mentioned training programs for peers, and Imagine Art would like to know, or any other organizations possibly, how they can partner with your organization to better equip the peers that they utilize.
Okay. Well, we've done peer training for various interventions that we've done. We have a whole peer training curriculum for health promotion that we develop as part of our Health Matters. And for this one, we do a peer training that's specific to this particular curriculum. And so we are going to be doing that with the next round of, when we do the next round of the Virtual Future Is Now, peer training with our peer trainers will be occurring. And we will be talking about that. Do you want to say some more about that, Katie?
I think you covered it, Tamar. Yeah, I think, you know, we're hoping maybe Texas will be one of the states that we roll things out to in the future. So we can be in touch about that.
We did do our initial virtual train the trainer pilots in Texas a few years ago, but it wasn't this whole virtual curriculum. It was just the train the trainer.
Thank you so much. Our next question is about the ARC, and the question is about, do you know if the ARC is still supporting the microboard opportunity? The person that asked this question said that they established a microboard for their daughter about 10 years ago, and it's been really a great support and helps with future planning.
Yeah, I'm not sure if the ARC is doing the microboards. It might be state specific as well. I know like in our state in Illinois, we had a big microboard project that our DD Council funded, and a number of organizations did, a number of families did set up microboards, which can really be helpful in the future planning process, and getting, you know, everybody that's on the microboard kind of on the same page in terms of putting together like a letter of intent and a plan and roadmap for the future. But it might be state specific in terms of whether the ARC is still working on those microboards opportunities. So I'm not sure.
But at the ARC, Liz Maher is the person that kind of running the Center on Future Planning.
Okay, thank you for that information. There is another question, and it is, who would you suggest to be part of the team when you do not have siblings?
Yeah, that's a really good question, and that can be hard. You know, siblings often are the natural kind of next generation of supporters, although not always. You know, you could think about if the person might have any sibling-like relationships. I know there are many, you know, families where, you know, maybe cousins serve as like a sibling-like relationship, but it's so dependent on each family. And you really want to think about, you know, who are the people in the person with IDD's life that are important, who has good relationships that you might want to strengthen, and you might want to start having some of these conversations and maybe planting the seeds for whether they might be interested in taking on a greater role in the future. And, you know, they can be chosen family members, maybe not part of your original family. You know, some people have developed such close relationships with professionals that, you know, have kind of gone outside of the realm of that paid support. And so it really is so dependent on each family. And it's really about thinking through like who's in your circle as a family, and who do you want to really foster relationships with, to potentially have some roles like that in the future.
Thank you so much for answering that question. If anybody else has a question, feel free to enter in the chat. This is your chance.
I have one question as we wait to see if there are other thoughts that people have that they would like to ask our presenters, other questions. What is one actionable item that you would recommend to family members to and attendees today to get started with the planning process?
You want to start, Tamar?
Well, I think that Katie gave some pretty good examples. Someone needs to initiate it. And somebody probably should start talking with the person with disability first, whether it's a parent or a sibling. Often it's a sibling that wants to get started, maybe the parent doesn't want to, or it may be in the context of somebody starting to do a will and then thinking about it. Often and sometimes can be very contentious if it's about a will, or somebody's about to sell a house or something. And I think at that point, a discussion needs to get started and somebody has to initiate it.
Yeah, I agree with Tamar, and I would add that a specific thing that my family did that was very helpful was we created something we call a day in the life, a day in the life of my sister Patrice, that really my parents mostly kind of like put down all the things related to her routine and her medications and her doctors and those day-to-day details that I, as a sibling, just don't know. And if something happened, if we had a crisis where, my parents weren't there to tell us those things, we'd really be like in a difficult situation. So it was a concrete thing for us to really just like put down and for my parents to think through, like, what happened? What is a day in Patrice's life like? And Patrice was part of that too, helping them remember. And then it gave all of us a clearer picture of just some key basic information that we might need to know and have in a crisis. I see another question that came in: who should have a copy of the letter of intent? That's a really great question. I think this is also very family dependent, and the letter of intent, there's different parts and sections of it. Some of it might have a lot of personal private information that you might not want or need to share more broadly with, or widely. But those key people, you need to identify that need all of the information, and then identify who needs what parts of, certain information in the letter of intent. You also kind of want to decide like who's the keeper of the big document, so that everybody knows where it is, who has it, who's in charge of that, and really think through those things. So the copy of the letter of intent, one key person, and then, it's family dependent on who else you think should be shared, the whole thing and then parts of it.
And I would just like to add the importance of continually redoing it, because it should not be static.
Yeah,
Even once it's done, it needs to be looked at maybe every year or when something's changed.
yeah, life changes and things can change. So yeah, definitely looking at it. It's kind of a living, breathing document that's always evolving.
All right. Well, thank you all so much. Thank you, Dr. Arnold and Dr. Heller, for a really great presentation. Matthew, yes, this presentation was recorded today, and all of the recordings for this session, as well as the next webinars, will be uploaded to our TCDD website. And follow-up information will be sent to those of you who attended today, along with the link for the PDF download of the presentation materials. Before you all take off, please, please, please take at least 30 seconds to 60 seconds to complete the evaluation. The evaluation helps shapes what we do through extension programming, TCDD programming, as well as what Dr. Arnold and Dr. Heller are doing too. And that link has been dropped in the chat. And then I do want to remind you all that there are 2 more sessions, part of this 3-part webinar series. The next one is July 20th from noon to 1 p.m. And that is, as Dr. Arnold mentioned earlier, on nuts and bolts of family future planning. And then the next session after that will be on engaging with aging in the future planning process. Future planning is intricate. As they stated earlier, Dr. Heller mentioned about the club sandwich, the double club sandwich. There's so many working parts to it, but I think being able to understand those working parts are what we are taking away as some key components of this process. A lot of resources were shared, and be sure to refer to the handouts for a lot of those resources that were mentioned. And thank you all. If you have any more questions, you can contact Dr. Heller or Dr. Arnold, and their emails are posted again on the display now. And then to connect with your regional coordinator, Skylar, just drop the link in the chat, as well as Dr. Heller and Dr. Arnold's email addresses. So thank you guys so much for a great presentation.
Thank you, everybody.
Thank you.